Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is Radiation Oncologist Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, a second opinion, access to clinical trials, financial counseling, or other supportive services for yourself or your family, even genetic screening for cancers, Central Care is here for you. At any time, feel free to email with any questions or comments to askdoctor@cccancer.com. That's askdoctor@cccancer.com. Well, the warmer temperatures are here, Doctor, and that means that people are wanting to spend some more time outdoors, maybe gardening, going to the lake, hiking, swimming, of course, exposing their skin to that Kansas hot sun. So we want to highlight that May is National Skin Cancer Awareness Month. So, of course, our discussion today will center on skin cancer. And this is the most common type of cancer, right, Doctor?
That's right. Thank you, Leanne, for having me here. And skin is the biggest organ in our body. And just like any organ, it needs to be taken care of. Unfortunately, it's the first organ of protection. It protects all our insides, and you need to protect your armor, which is your skin. So what happens with exposure of the sun is actually radiation from the sun that causes cancer. It's a low-grade radiation. It's electromagnetic, and it causes your skin cells because they're sloughing off. See, the problem here is that our skin is continually changing and sloughing off. The dead skin cells are we're losing them, and new cells are coming in. So in this type of very active organ, these cells are exposed to the sun, and then they start being changed or mutated. The basal layer starts being exposed to these changes, and then they become irregular and cancer. They become precancerous or cancerous cells, either in the form of basal cell or squamous cell. There's other cancers that can hit the skin, and some people are more vulnerable or more have more tendency to have, like melanomas. And there's more than just those. There's, for instance, lymphomas. There's cancers of some of the sweat glands, some of the glands of all of our body. But these are the three main important cancers: basal and squamous cell carcinomas, which are the most common, and then the melanoma. So if we talk about the basal and squamous cell carcinomas, the two distinguishing parts of them are what they look like. The squamous cell carcinomas look like they're kind of like flaky, they're dry, they look scabby, they bleed easily, and they are usually located in where you have the most exposure. So if you were a sailor in the sea, and you would have maybe your forearms would be exposed to the sun, and your head and your face. Those are and it's a constant thing. Those are the areas where you would have the majority of your cancer. Now, if you're a sunbathing beauty and you expose your entire body, well, all your body is going to be exposed to the sun, and everywhere is at risk. Now, for women that wear, let's say, a tank top, the skin is going to hit them directly to their face, and actually their chest area, what we call the décolletage, or the very front of before your cleavage, let's say, is hit harder because of the angle that the cancer hit. The sun hits, and this area is often where we see cancers. These cancers, unlike the basal cells, which look like a ring, they have a pearly border to them. They have a ring looking. They look like if it was a little ulcer, but they have a ring around. They are more benign, the basal cells. They need to be treated because they can continue to erode your skin and start working on lower structures. Let's say you had it around the temple. Well, they can be so big that they go into your brain, but they usually don't travel. However, the squamous cells can travel into your lymph nodes and into the system. They can go into your bloodstream. They can go into your bones, your liver, your lungs. So they can go into your, any part of just like any other cancers that are in other parts of the body. They can grow in three ways. Locally, meaning if you have it around your jawline, they can grow into your bone of your jaw, but they can go into the lymph nodes of your neck. They can go into your bloodstream and go everywhere. So none of these are friendly. You really need to take care of them. And if you take care of them early, that's it. Surgery usually does the trick. You can have them removed. Now, of course, if they're involving your eyelids, you don't want to have your eyelids removed. So we may have to do something different, like, for instance, radiation to take care of them. But if most of the time the eyelids are not the issue, although they can be, usually they're in the arms, as I say, or other parts of the skin where it's very accessible to just have them removed by your dermatologist. And they usually have an aesthetic way of handling it, so you don't see really the scar, and it's actually quite easy. But of course, once you have one, you're now going to have more. So for anybody that's had a basal or squamous cell carcinoma, you will need to go to your doctor, whether it's your primary care or your dermatologist, to be checked everywhere for another one sometime down the road.
So does it take a while for the skin cancer to establish? I mean, as far as the diagnosis of what it is? And
it does. Actually, many of not the basal cells, but the squamous cells usually are premalignant first. They can be kind of scabby or just, there can be some dysplasia of the skin, which can be treated with just a cream, actually. Mm-hmm. And it never becomes cancerous. So is the time to treat. Now, if you can imagine having like those golfers I see where all their face is completely covered with pre-cancerous situation, and they continue to do golf with a cap, not a hat, what are you going to do? How are you going to take the entire skin of your face and your scalp away? And you can't do that. So don't get to that pickle. Don't go there. So you need to, and then not only that, but here, golfers, please hear me. There are things in the grass. There's some chemicals in the grass which are going to get to your skin, herbicides, insecticides, etc., and they're going to cause cancer of your pretibial region. So again, wearing socks and pants are really a good idea.
So between the basal and the squamous cells, I mean, one of them is more on the upper layer of your skin and the other is more deeper. Is that right? Like near the epidermis or?
Yes.
Okay.
The squamous cells are really formed more superior in the epidermal layer of the skin. The basal cells are more the basilar level, but they're very close. Both of them are, really related to the sun exposure.
Right, exactly. So is death, is that even a possibility with skin cancer? I assume
yes,
so. Yeah,
absolutely. There's people that have a condition that have a very, very aggressive basilar carcinoma syndrome where it goes and actually does spread everywhere. This is very rare. There's actually a special drug that has been recently used very successfully with these, but these are very aggressive basal cells. That's not the common. The most common basal cells are small and easily treated. The squamous cell carcinomas, I see this quite a bit where they're neglected. I have a gentleman right now where he just didn't want to. He was a very busy man. He's a farmer, and it has basically taking his ear and is going into the brain. So there's no reason for that. It would have been easy to just remove that bit of let's say, I think it probably started in the ear originally, and call it good. But, it was like it wasn't important, and then it became out of hand.
Again, I'm with radiation oncologist and president of Central Care, Dr. Perez-Tamayo, and we've been talking about skin cancers. Doctor, let's get into prevention and, of course, the signs and symptoms there for basal and squamous cell cancers. As far as prevention, of course, it's unprotected skin exposure, to those UV rays from sunlight. Do people still use tanning beds? I don't
They
know.
do. Tanning beds are still being used, although less because now we have the fake tans, which I
Yeah.
think are a better situation. But there's other things that can have you have cancers of the skin. And for people that have transplants in particular, there are some medications which make you unable to fight even the smallest amount of exposure changes. And these people have a cancer of the skin that goes kind of wild because their immune system is being turned off so that they don't reject, let's say, a kidney. Then, of course, if you have a rheumatoid type of problem where your immune system, again, is weakened, you can have more problems. Family history, and there's actually genetic congenital problems where skin cancer is almost at the time of your birth. So there, you have the people that are light colored skin, especially if you have this red undertone to your skin, the Irish, Scottish type of coloring, have a bit more risk of having cancers when you have exposure to the sun and the elevation where you live. The closer you are to the sun, the higher your risk. So if you live out in the mountain, you're going to be at higher risk. And of course, as you get older, you have a higher and higher risk of cancers.
Pay attention to your body too. I mean, if you notice any discoloring of or changing of some sort of a spot in their size, shape, or color or something, I mean, you need to bring that up to your doctor.
Absolutely. And taking a picture of it is a good idea because then you have a kind of a almanac of what is happening to that pigmented area, or if it's changed, and you can then see, okay, this used to be this way and now it's this way.
Talk about what a screening involves when you visit, let's say, even your healthcare provider or a dermatologist.
Okay, this is a dear to my heart topic. You need to get your money's worth out there. Ask for it by name. It's one of those kings who knives situations. You do not want the fake one. So when you get a screen checkup, I'm talking a screen checkup means between the toes, under your feet. The genital area is very important, including the anal area, and it includes under the breasts, and the axilla, everywhere, the skin, including your scalp. And then there's other things, including one more step, which is going to your ophthalmologist, optometrist to check your conjunctiva, which is the first layer of your eye, the sclera, the second layer of your eye, and then the back of your eye, so that, because melanomas can do that. Now, you can have melanomas inside your body too, and those you cannot see, but those are different. So these are the ones that you can have a lot of impact on by just making sure you go to your checkups.
And it's so important yearly too, right?
Yearly, but you can do it yourself, or your husband or wife can do it for you, because it's very obvious that something isn't right.
Just like with any other cancers too, there's offshoots of skin cancer, like Merkel cell.
Yes.
And there's just other, and that's just another type of what do you say to describe it?
Merkel cell is a very special type of cancer, which is a spectrum of cancers that we see from. The origin of the cancer is really unknown, as where it started when we were an embryo. It could have been a neural crest cell, but nonetheless, it is a very aggressive cancer. It likes to travel in the blood and then into the lymph nodes. It can happen just any part of your body, inside or outside. But there's other cancers that are rare, as I said before, of your glands, and they're also very aggressive. They can also have lymphomas, for secondary and primary, and what that means is that they started in the skin, that would be primary, or they went to the skin because you have a lymphoma elsewhere, and then it traveled to the skin. So it could be of the skin, or it came to the skin from elsewhere. And it's important because the treatment is very different. And then, of course, we'll talk about later, the melanomas are very important to talk about. But there's others. There's sarcomas. So there's many, many types of cancers. But the majority, 99% of them, are what we just said, the squamous and basal cells.
Skin tags, are they not considered any kind of type of cancer?
Skin tags, but they can, these all of them, melanomas, basal cells, and squamous cells, can present as pedunculated, or meaning like a tag lesion, where it started and then it started to grow from like a bouquet, let's say, where it then flowered out like a wart. They can look like warts. And the skin is also susceptible to HPV.
I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center. We've been talking about skin cancer, and primarily basal and squamous cell skin cancer. But let's get into melanomas. Melanoma's a whole nother ballgame when it comes to skin cancer. It's developed from pigment-making cells that are found in the epidermis. Right, doctor?
That's right. It's like a freckle. It could be like a freckle, a malignant freckle. In fact, it used to be called that. And these freckles behave very differently. The normal freckles, although they can arise from a freckle. So just be aware that a freckle can turn bad on you. And that's why if you have the tendency, or you have a family history of melanoma, or the freckle is in an area that is exposed by the sun, perhaps it's the best thing to just remove it. Now, most freckles will not turn into melanoma, but you need to be aware of all the moles in your skin and take pictures of them. Now, melanomas come from pigmented cells, and because they are completely different than the epidermal cells that cause the squamous cell carcinoma, the basal cell, bacillary, they are from melanocytes, cytes meaning cells. Melan is that they produce color, so that was what gives you the pigment of your skin. And then there is, like residual skin patches, which can then turn malignant. And this is where they can be anywhere in the body or inside the body. People that are fair and they come from Ireland, Scotland, that sort of English and German, there is a higher tendency of having a hereditary type of melanoma. There's mutations, and there's actually many now medications and immunotherapies that are being investigated and now have shown very much promise in curing and even advanced cancers. If you have not only the family history, but maybe you have a weakened immune system, like let's say a rheumatoid problem, and rheumatoid meaning many things. Like you could have an autoimmune system like sarcoid, or you can have a transplant, or you're older. There's a tendency to be more in the males. You are at higher risk. Even if you're at higher risk, prevention is important, and that is to be less. You need to be out in the sun less. In fact, many Australian people have a very large campaign against melanoma because the colony, the penal colony, actually, Australia was a penal colony, and it was many of the people transported to Australia were from England and from Ireland and Scotland, and they have a very high a percentage of melanoma, and there's a high campaign there of how to make sure you are going to be safe by wearing hats, wearing the sun blockers, examining your skin to make sure you get things early to avoid having this go into the blood and the lymph nodes, because it does.
And when you're talking hats, you're not just talking something that's pretty puny on your head. You're talking full brim, wide brim hat to cover at least even your neck and shoulders, some in the back of your neck.
Absolutely. Yeah. Not a cap, but a hat. And also there are certain shirts that have more protection from the sun. There are companies that make special clothing to give you the blockage. Actually, physical block of the sun is the most important thing. And also, don't go out in the sun at 12. If you're going to have activities, do it when the sun is either early in the morning or later in the evening, so that you don't have full sun. So again, using your sunscreen, and your sunscreen is something that has to be put on and absorbed. So it's not just putting it on and I'm going outside. It's putting it on, letting it absorb, putting it on again. And if it's going to be where you're going to be active and sweating or out in water, again, you're going to have to apply it. Now, protecting your eyes is important, again, because melanoma can affect your eyes. So using, glasses that are very tinted, and from the sides as well, because the sun can come in through many parts. So if you're one that drives a lot, for instance, your eyes are going to be continually being exposed, as well as your skin, to the sun. So people that drive for a living need to consider covering their head, maybe using a bandana in addition, and sunglasses, are important.
So when you mentioned the sunblock, I'm taken back to a time where I might have used some sort of coconut oil smelling like oil to put on my skin at the swimming pool. But I'm sure that the sunblock or the UV, it was only maybe like a 15 at the time SPF. But I mean, recommended though would definitely be something 30 and above, right?
That's absolutely right. And blocking, there's others that actually are even more. There's some that you can, talk to your dermatologist about that are even more blocked, and especially that are absorbed, because one thing is that you see it, but it does nothing. It just stays and goes away from your skin. You need something that is, that's going to have some reputation, and it's going to have, a staying power, because it has to be something that you're going to maybe even apply several times a day, not just once, and maybe at night before you go to bed, so you're ready for the morning, if you're going to get out in the morning. So, and again, be aware of your molds. You can't see your back, so you might have somebody take a look at your back and take pictures of anything that looks abnormal. And here again, the melanomas, the ABCDE rule.
Yeah.
So if you see something that's asymmetrical, usually your freckles are pretty round and have distinct borders. So the B is for border. If it's irregular, so that's the B part. Asymmetry, borders are irregular. C is for color, meaning it is dark, could be almost tarry. D is for diameter, if it's larger than just a freckle. And E is for evolving, meaning changing. So the ABCDE. Evolving, changing. So here's where the picture comes in. If you have a photograph and you compare it and it's changed, that's not good.
Any kind of itchiness or scaliness too? I mean, again, that just goes back to maybe some sort of squamous or basal cell, or is it just as far as like a symptom or a sign?
Unfortunately, there's not any itchiness or pain. It can be flaky, but not necessarily. It can be bothersome if it's in a spot that is being irritated by something that is there that is not happy. Your body's not happy having it like in a fold. But usually no. If you have a swelling, it usually is it's already spreading. So you don't want that. If you have a mold that is itchy, tender, scaly, oozing, bleeding, okay, that's not a mole. So, that's something that should be taken care of.
What about treatment options here for melanoma? Is it mainly, some sort of removal, I would assume, or?
Most of the time there's surgery involved in that, and it depends on where it is. As I said before, there's now new agents, and I'm not going to go through them because it's really complicated. But there's immunologic agents that have really given a completely different life to people that suffer from melanoma. And for instance, the eye ones can include plaques, radiation plaques, it's called brachytherapy, to hopefully preserve your eyesight. Depends on where it is in your eye. But again, you should not ignore symptoms. Many times these things can be taken at an early form, even there's pre-malignant melanomas, and removal is the cure, and you need nothing else. So unfortunately, if you have a melanoma in your thorax or your abdomen, it can go just about any direction. Imagine there's really, it can go up, down, around, While if it's, let's say, in your face, it tends to be more confined to that region. It can go down your neck. It's actually more manageable. So the location of the melanoma can dictate how it's treated.
So bottom line, when it comes to our skin cancer, protect the skin that we have. It's because it's what we've got to protect our body, for sure. Look for those signs, those changing spots. Even the moles, if something is, abnormal, out of place, talk with your doctor, get a regular screening, and as well as use your sunglasses, your wide-brimmed hat, your sunblock to help, prevent those sun's rays from penetrating your skin. And
also consider your background. Consider your potential risk, because it's not everybody has the same risk. So if you go with your friends to the beach, you may be very fair compared to your friends, and don't be afraid to use your intelligence to protect yourself perhaps more than your friends would need it.
Yeah, definitely. Anything else you want to add?
No, the only thing, again, I would be more than happy to see anybody's abnormal freckle or abnormal scaly patch if there should ever be a concern. We often have screen checks that are free, and fairs that we attend that we would be more than happy to see and tell you what the next step would be.
Do you get stopped often and asked, hey, Dr. Perez-Tamayo, what is this cancer, as they point to something on their body?
It's not a uncommon situation where people that see there's an abnormality would be concerned about it. And here again, showing it to your primary care would be the best way to get into the right channel. But we are there to see you if there should be any concern.
That's right. We're there for you to help you, for sure. Thank you, Dr. Perez-Tamayo. Well, we appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care, all under one roof. So there's no need to travel far for the best care. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, maybe financial counseling or other supportive services for yourself or your family, even a second opinion, Central Care is here for you. You have a choice. Bringing that expert care to you is an important component to the success of your outcome. Being surrounded by your family, your friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110, or you can visit us online at cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.